general aches and pains. If you have low back pain that is, that has just been chronic and is not really ever going away, one of the problems is when we get stuck in to that chronic pain cycle, your mitochondria, or the cells in your the mitochondria in your muscle cells are not producing enough energy to really repair or to repair quickly. And so, shoulder pain, back pain, we can localize it, we can upregulate and get rid of the inflammation, and then by getting more energy out of the mitochondria, that helps repair faster. So you get the added benefit of not only lowering your pain, which again is as effective, the low-level light therapy is as effective as painkillers to do this with no side effects, and then you repair faster as well. So they've started to use the lasers on almost everybody, and we want to expand this, but I mean, for the people that are just having muscle pains, aches, sprains, strains, that's, and again, a lot of people are coming out of January where they've probably started working out again, or they're getting back in shape, and so they probably have some aches and pains that they didn't have. So that's the right, that's really the area that we're going to try to target immediately, and it's really effective.
Great. Okay, cool.
Excellent. And then, just one more quick thing. I mean, as we've been getting into the research, I mean, they're starting to use the, low-level light therapy or the lasers on migraine patients, on stroke patients, to help recover, anything that you might have lost in some type of cerebrovascular event or, cardiovascular events. So, I mean, it's truly a game changer. I'm actually shocked at how little that people are talking about this, or how this, how it's not being used in therapy, more often.